Well, good evening. So good to have you here. I want to welcome everyone here. We have a number of guests from our community, some awesome public servants that do so much for us. I know we have several folks here from our church. I'm glad you guys made it a priority to be here. And we're super happy to have all these folks that are going to share with us some important information and also just help us to be motivated to be the community participants that we can be. Here at Ellendale, we believe that God placed us here for a reason, that not just here individually, but He placed us here as a church for a reason, and we want to be a neighborhood church that invests in our neighborhood and invests in the community around us. And so events like tonight are going to help us do that with greater effectiveness. And so I hope we'll all be engaged. I hope if you have questions, you'll ask questions. If you don't have questions, you'll think of questions and ask those questions, all right? Because this is what we want to do tonight. Let's open in a word of prayer, and then I'm going to hand it over to Jack, and he's going to introduce everybody. Let's pray. Father, thank you for the opportunity we have to listen and to learn. Thank you for just community leaders, community servants who invest in people around them. And Lord, I pray that we would be that kind of church, the kind of church that's not caught up in consuming, but that we would give as you gave to us. Lord, I pray that you would be honored tonight through our interest, through our learning, and we pray these things in the name of Jesus. Amen. Jack, come on, man. Welcome.
Hey, everybody. Welcome. My name is Jack Wyatt. I'm the director of the Memphis Area Prevention Coalition. We really want to thank Ellendale Baptist Church for welcoming us into your home and your place of worship to have these important conversations as a community. Tonight we've got a panelist of someone from the Memphis Police DARE program, from MAD, from the Shelby County Schools, and the Shelby County Health Department. So we're real excited. These are all experts in their fields. I'm very good friends with all of them. They are amazing people, and they really care about their community and the work they do. So I think you're going to really enjoy listening to what they have to say. I understand this is the fourth of four workshops or so that you've had on this topic, and so we really appreciate you letting the coalition be a part of this. I'd like to ask the staff to come up real quick. So this is the staff of the coalition. I'm going to let them introduce you and say a few words about what they do, and then we'll let Jill tell you the good news about something we're going to offer you at the end of the night. But anyways, and so I'll let them introduce themselves real quick.
My name is Josh Weil. I am a regional overdose prevention specialist for Shelby County. And Jill and I both are. We have 2 here in Shelby County. There's 20 of us across the state. And our jobs were created in response to the opioid crisis. And I'm sure everyone's heard of that by now. It's all over the news. It's been an ongoing thing. We have a lot of fatal overdoses due to opioids. There's some synthetic opioids on the street. Fentanyl overdoses are up 975%. So we are seeing, a rise in the deaths caused by opioids. It's the number one cause of accidental death in the country right now. So we train people on this drug Narcan that will actually reverse an opioid overdose, and we distribute it as well. So we can give it to individuals, we give it to agencies, we've given it to law enforcement, so that it's out there, hopefully within arm's length of the people that need it.
Hi, I'm Jill Corney. He just told you what I do too. The same thing. We're both nurses. We're both in recovery. So we have personal experience with how this addiction can creep up on you and devastate your whole life when you're a good, God-loving person and you get sidetracked. So to be able to come and talk about the stigma of addiction and decrease that, put faces and names with getting better through, I'm allowed to say through God, because I'm in church, and get okay, yeah. I'm here. I can say the truth. My truth is that I've quit suffering because I now have faith in a higher power, which I call God. And we go out, and not only do we train people in Narcan and help save lives that way, we also offer hope and say we can get you into treatment, we can get you to a meeting, or just let's sit and talk. That there is a better way, and we got out of that hole of desperation. So I am grateful to be here, and thank you for having us. And we're going to do Narcan training at the end. If anybody would like to stay and have it, we will do it, I guess, out back when we're done, or up here. We'll decide on that later on, but we're going to offer that to y'all. Thank you.
It's okay. I'm Lincoln Kaufman. I'm the Lifeline Peer Coordinator for Shelby County, Tennessee. There's 10 of us across the state. We work to reduce stigma around substance use disorder and mental illness. We work to try and help direct people to resources that are available in the different regions across the state of Tennessee. So here in Shelby County, I answer phone calls via the Red Line. It's a toll-free number that goes to TATIS operators in Nashville for people seeking treatment, help, services around substance use disorder and mental illness. So it's kind of my job to get very familiar with what we have to offer here in Shelby County and direct people that are seeking help to those services and facilities that we have. I also work in the faith-based initiative, trying to help establish a network of churches across the state to also be involved and communicate with each other and share resources across the state. I start meetings, recovery meetings of all different types, like Celebrate Recovery, Alcoholics Anonymous, Narcotics Anonymous, Al-Anon, MARA, a whole lot of others too. And I'm a certified peer recovery specialist, so I answer a lot of phone calls, end up talking to a lot of people. I'm also in recovery, have been involved in the Memphis recovery community for 8.5 years. And am I leaving anything out? Okay, I think that's good.
That's all.
So to sum that up, if you need any kind of resources concerning treatment or anything like that, Lincoln's your guy. If you've ever just said, hey, I wish I knew somebody that knew the entire Shelby County system of treatment centers and mental health centers, Lincoln's your guy. You can get his card tonight before you leave. He's a great resource. Jill's gonna, if you want to have the overdose prevention training at the end of this, it'll be about 10 or 15 minutes. She'll meet back there after the town hall. She'll help you identify overdoses, and she'll also give you a free kit that would normally cost you about $80 at CVS or something. $90 at CVS. We're going to give you that free of charge, so you'll have that. You keep it in your glove box. You never know. Someone dies every 2 days here in Shelby County to a fatal overdose from opioids, and so you just never know when you might need that kit, and you could save someone's life. So anyways, and then I want to tell you about a couple more programs that the coalition has. We have a new needle exchange that just started called Safe Point. We're still kind of in the, what would you call it, the beta stage. Like we're trying to figure this out, but it meets every Wednesday in Midtown. And then last but not least, we have the prevention program. And that's where you come in. And so I'm very excited tonight. This is the first event in the history of the coalition that we are offering. You can sign up now to be a member of the Memphis Area Prevention Coalition. We encourage you to do so. It's a great place for you to voice your opinions and try to help change policy here in Shelby County. So if you fill out one of these forms, it'll ask you a few things. If you want to be a volunteer, if you want to be part of the alcohol, tobacco, or drug task force. And we will start meeting as a community in January, right after the holidays. And so it's a good way for you to give back to your community, be involved, let your voice be heard. And so we encourage you, if you're interested, to fill out one of these before you leave tonight. We'll just leave them up here, and when this is over, if you want to grab one and fill this out, we'd love to have you as a member of the Memphis Area Prevention Coalition. So without further ado, I'll ask the panelists to come up now. And so I think the way we'll do this is each panelist will speak for about 5 to 10 minutes about their perspective about what kids are facing today concerning alcohol and drugs, correct? And then after that, we're going to open that up for questions. You can ask the panelists questions. And I want to introduce someone else real quick. Ms. Shelby, would you stand up real quick? This is Shelby Jones. She is a volunteer from the University of Memphis. She is tonight she's volunteered to take notes. I actually learned this from Mr. Sweat. And so she is going to take notes tonight about everything that is said and recommended. So this is not going to be just another hot air meeting. Shelby will type up the notes and the questions from the audience and the things that you suggest to the panelists. And the coalition, the Shelby County Health Department, Matt, we will all take this data and these questions and we will try to implement them into our program. So just want to let you know that your voice will be heard tonight, and we'll take into consideration everything that all your feedback. So without further ado, I will let each panelist just introduce himself, and we'll start with Judith.
Good evening. My name is Judith Johns. I am the West Tennessee Program Specialist for Mothers Against Drunk Driving. Our mission for Mothers Against Drunk Driving is to end drunk driving, help fight drug driving, and support the victims of violent crimes. A little bit of facts. Teen alcohol use kills about 5,000 people a year. About 30% of 8th graders have tried alcohol, and 1 in 7 teens binge drink. My job is to go into the schools and talk to the youth about underage drinking. I also talk about drug use also. There has been a rise in marijuana use among children. I try to explain to them that marijuana use is just as dangerous as drinking alcohol. A lot of the children have been victims of getting into cars with adults that are under the influence, and they don't know how to express themselves to their parents about not getting into the car. I suggest to the young people to talk to their parents when they're sober and explain to them that they don't feel comfortable with getting into the vehicle with them. So we do a lot of great things at MAD. We also have victim advocates, and they help victims go to courts. They help them find friends that have also been through circumstances like crashes, car accidents. Well, we call it crashes because accidents is an accident, but a crash could be preventable if you don't get into your car under the influence of drugs or alcohol. I have tons of information with me. We give out these booklets to parents to help them talk to their children about alcohol and drugs. I also hand out a pamphlet for the children to explain to them the dangers of drinking and driving and doing drugs. We are also looking for volunteers if you would like to join Mothers Against Drunk Driving, or if you know anyone that has went through something, a tragedy, as such as a car crash, losing a loved one. We are here for them to support them. I have information. You can see me after the program.
So good evening. I'm David Sweat. I'm with the Shelby County Health Department. I'm the Chief of Epidemiology and Infectious Diseases at the Health Department. And as far as my involvement with our behavioral health efforts here in Shelby County, it really goes back for me a couple of years when the Shelby County Commission and then Mayor Mark Luttrell charged the Shelby County Health Department with helping form a response plan to the opioid misuse disorder epidemic here in Shelby County. And the group that I chair within the plan is the Data Use and Integration Committee or work group, but there's many different organizations and many different work groups as part of our plan, and our plan really centers around 5 things. First is, this is not reportable. So a lot of the things that I work with in disease are reportable conditions by law. So if somebody gets a salmonella infection, anthrax, West Nile virus infection, HIV infection, these things, those are all reportable events by law. But a drug overdose is not. There's no law that requires, there's no registry or database of that. So we've had to invent ways of determining what the impact of this epidemic of substance use is on our community. And over the past 2 years, we've been very involved with that in my work group. But we also have a treatment and recovery, prevention and education work groups. We have a law enforcement and first responder work group, and we have the harm reduction work group. So those 5 pillars form the basis of our opioid response. here in the community. And the Prevention Coalition and many other organizations are part of our work groups. And I'll just hit you with a couple of quick facts and then move on to the rest of the panel. But we have, as Jack mentioned, we have about a fatal overdose every couple of days in Shelby County. We are having about 8 drug overdoses a day that EMS systems in the county go out on. So that's either Memphis Fire, Bartlett, Millington, Shelby County Unincorporated, whatever. But the ambulances roll out on an average about 8 times a day to help people with drug overdoses of all kinds, not just opioids. So we also get data streams from the Forensic Center about fatal overdoses. We monitor emergency department visits, and we monitor the Narcan distributions with improvement by the fire departments. So what I can just tell you in brief, we're averaging, as I say, about 8 overdoses a day. About 2 or every 2-3 days we get a fatal overdose, and then we're averaging about 16 to 20 emergency department visits a week, and about 80 responses, during the week that go out. And we're approaching 300 deaths for the year in Shelby County from all drug overdoses. That's not just fentanyl, but that is the major drug. We also have cocaine overdoses. We have benzodiazepine overdoses like Xanax, et cetera. And most of it, actually, for folks who die is polysubstance. So the average number of different substances in someone's body when the forensic center receives them is 6. We've had a range of 1 to 12 this year. So there was a person who died had 12 different substances. So it's a multifaceted issue, and I'm really glad that you're here tonight to learn more about it. And I want to echo that stigma is really the biggest barrier, the first one we must overcome. And I was just sitting here thinking, as I was sitting in the pews, I was thinking about Jesus and thinking about the places that Jesus went in his ministry, right? He hung out with lepers. And so lepers were, in Jesus' day, probably the most stigmatized group of people in Palestine, right? And so if we're going to make any kind of difference in people's lives, we have to be willing to overcome stigma and prejudice and just, recognize the human being before us. Go ahead.
I'm Anna Soverall, and I kind of wear a couple of hats. I work for the Shelby County Schools Mental Health Center. A lot of people don't know, but Shelby County Schools has their own independently licensed mental health center that serves all the students in Shelby County. I supervise a team of 14, and we go out and serve about 35 schools. Probably the closest one to here is Cape Bond. I also supervise the alcohol and drug team, which is a very small unit. There's only 7 of us for the whole district. And what we have focused on, we started last year primarily in the alternative schools, working with a program called 7 Challenges, and it challenges the youth to make better decisions in general in terms of, being educated about things and not just making impulsive choices, but to try to come to more reasonable decisions about any kind of use. In the schools, we see, like you mentioned, a lot of increase in marijuana use. Regardless of what you think about it, all the legalization around us has really confused the youth. And, it's led them to believe there's no harm. And, even younger kids getting some of the edibles that, now are showing up in the community, that's been a problem. So any place that we've had those kinds of things, the edibles particularly, we have sent in a couple of our people to do prevention workshops. We have a video that talks about marijuana in the teenage brain, which is different than marijuana in the adult brain. The teenage brain is still forming, and a lot of the pathways that have to do with judgment are not yet fully developed, usually not until people are about 25. So we do the prevention stuff. We also offer early intervention services to kids who have had some sort of disciplinary offense related to substances, any kind of substances there. And those are the students that we form these groups. 7 Challenges is the name of the program. And they go through at least 10 sessions. Some of them have to do that as part of going back to their home school. We have also this year started branching out more into the high schools that have sent the highest number of kids to the alternative school. So we're expanding out a bit more into all the schools.
Good evening. My name is Officer Katanya Miles. I've been with the Memphis Police Department for 20 years. What I do is I go into the schools and I teach the DARE program and the GREAT program. DARE stands for Drug Abuse Resistance and Education, and the GREAT program, Gang Resistance Education and Training. These programs are preventive programs. The DARE program is 10 weeks, and we focus primarily with 5th and 6th graders. And the GREAT program is a 13-week program, and we focus primarily with 6th and 7th graders. As you know, we do have drugs. They have no economic, no religious, or geographical boundaries. In the schools, we are dealing with that all the time. Some of the top drugs that are used by teens, as a matter of fact, the number 1 drug used by teens would be alcohol. Teen drinking is often looked at as normal and is much prevalent. And also marijuana, the second drug. They feel that that is harmless. It grows from the ground. So, and the third drug that teens mostly get involved with would be prescription drugs, and we're going to talk about that. Thank you.
Any questions right now for any of the panelists, or do you guys have any other comments or anything?
One thing I would say, I know that we're talking about youth, and it's always important for us to do that. But when it comes to opioids, I think it's always important for us to share the data and information, because a lot of people don't realize that the age group most at risk to die from a fentanyl or opioid overdose are adults over the age of 50 years old. And in fact, the modal age meaning the most commonly reported age that we have for overdose deaths in Shelby County from fentanyl is 56 years old. And in between 2018 and 2019, that has been the biggest area of growth, is deaths in people aged 50 plus. So we think that a lot of things are going on there, but one of them is social isolation or using substances, even taking pills, but you live alone or nobody knows that you're doing it, and then they don't know that you're in trouble to dial 911, you're discovered dead. And that is the most common EMS fatal run there is somebody found dead at home. And the most common age it's affected is people in their 50s. So it's not just a youth problem. It's a problem. And it's a problem for male, female, black, white, every age group in our community. Officer
Miles, one question I had. Do the does the DARE and GREAT training, is that all 6th and 7th graders, or is that just certain schools? How does that?
We focus our attention in the Shelby County schools. It's only 4 officers out of our unit. So a lot of schools, whether you know it or not, or be surprised, they don't even want the program because they feel that kids are not getting involved in drugs, and somehow they don't need to know. But we focus primarily, we'll start with the 5th grade.
Okay.
Yes, we're teaching there.
Good, thank you. Any other questions?
I was just wondering, what do you think is the biggest challenge for our youth today concerning alcohol and drugs?
I would say social media. A lot of the children are on Facebook, Instagram, Snapchat, and they see their peers interacting with drugs and alcohol. And so it motivates them to behave in such manners too. I would just suggest for the parents to be more involved as role models, because children do look up to their parents. So it's our responsibility to maintain a wholesome home. And make sure if you are consuming alcohol, that the alcohol is put away, that the child can't see the alcohol.
You know, I think for me, the biology of things with addiction is a real challenge. And as we've already heard, the developing brain, you know, I've got 3 daughters between 19 and 23 years old, and I swear none of them have grown up yet. And they're all great, but I mean, sometimes. And the first addictive substance that most folks encounter is nicotine. And we had made huge strides in Shelby County. We had actually gotten nicotine use down to as low as 7.5% in our young people just a few years ago. And now 25% of our high school students are vaping, and they're vaping nicotine. They're getting addicted just like the World War II generation did on cigarettes going overseas to fight the war. So we are losing the battle on nicotine addiction. And, you know, nicotine is really the first drug. And then it goes to alcohol and marijuana and everything else. And not everybody goes down that progression. They don't use all substances. But your brain, okay, the brain responds to this. It hits dopamine receptors. It stimulates that reward center is going off with these various substances. And for a certain percentage of folks, that opens up their pathway to addiction. So that's, I think, the biggest challenge.
I wanted to piggyback a little bit on what Judith said. When she mentioned social media, I'm seeing that as also a source of tremendously increased anxiety and depression among youth. The number of suicide threats we get each month would amaze you. From all ages. Actually, we get more in our middle schools, and a great deal of the time, it's some issue that's blown up on social media that now everybody in the school knows about, or pictures or things like that. And oftentimes, the kids that start using alcohol or marijuana will talk about using it as a way to cope with other things that are going on in their life. So that's why our program focuses on helping them learn other ways to cope and to make better decisions.
I agree with the social media. A lot of problems stem from school with social media going on. Kids are, and also peer pressure is a big part of that as well. I just, as being a part of the solution, I just think that parents just need to get more involved in their kids' lives and know what's going on, know what they're doing. And, as a community, as a church, how we can solve these problems with our teens is just talk to them. A lot of times we just have to step outside of these four walls, and we have to go into our community and get involved with our children.
I would add to that, in addition to talking to them, if you ask a teenager what they most would like from a significant adult in their life, they will generally say, just to listen to me, not necessarily to have an agenda of something to persuade me about, but just to listen to me. So listening is a really good thing too. And monitoring the social media, kids get into a lot of stuff, and parents really, you need to understand the technology well enough to be able to check up on your child and see what kinds of sites they're visiting.
Well, and psychology is also showing us that you can get addicted to social media too. And so when our phones buzz, that little chirp, that stimulates the dopamine as well. So we get a hit, we get a rush in our brain from getting a text. And as much as you don't believe it, from getting an email signature come in. You don't want to read all those emails, but you sure do like hearing that they're coming in. So, so social media is a problem on many, many levels, but it's actually addictive, just like cigarettes.
And I guess I'll comment again. Another thing that I see is the secular music is a big problem. Rock and roll is out the door and rap music is in the door. And it's becoming an issue with our teens as far as drugs, alcohol, guns, degrading women. So just to piggyback off of what everyone says, social media. So adults, just be aware of your teens, what kind of music they're listening to, what they're viewing on their social media, who are their friends that they're hanging out with.
As was previously mentioned, that one of the issues with addiction or drug abuse that the youth are trying are prescription medications. What are those prescription medications and where are they getting them?
I'll jump in that they're getting them most likely from an older person's medicine cabinet. And I'll let Dr. Sweat comment on what they are.
Well, in terms of the substances, they're going to be the things, whatever you've been prescribed. And yes, grandma's medicine chest, mom and dad's medicine chest, anybody's medicine chest is where the drug is found. And it would be Valium, it would be Xanax, it'd be oxycodone, hydrocodone, Darvocet, Percocet, Dilaudid, whatever. And a lot of folks have been prescribed these pills, and they're in medicine chests. And one of the things that we actually give out at the health department, I don't have any with me tonight, but you can get them also from, like you can order them from Amazon or get them at Walmart or whatever, are these lock boxes for your drugs. And what we are encouraging people is if you have prescription medication, lock them up and don't tell somebody what the what your combination is to get in there. Don't send your teenager to go get your drug and bring it to you. Do it for yourself, because people over at your house rummaging through your stuff and stealing just one or two pills. They don't take the bottle, right? They take one or two pills. And so that's how they get it to start with, a lot. And the other is getting their wisdom teeth cut out and being prescribed too much painkillers. And that's actually the number one way people get their first prescription for opioid painkillers is wisdom teeth removal, and somebody overprescribed, and so they only needed 2 or 3, but they had 10, or they only needed 2 or 3, but they had 20, and then the temptation to use those additional pills in a way that's not necessarily medical. is very real.
Now the teens are also having these parties, and sometimes they'll call it the Skittles party. And these Skittles are opioids that the doctor just mentioned, Valium and oxycodone and things like that, and they call it Skittles because they come in different colors, and they look like candy, but they are really drugs, so that's something to also be aware of.
So I was raised in the Nancy Reagan, this is your brain on drugs generation. Parents basically told us, don't do it. And that was the extent of the conversation. So how do we, or where do we go to talk about kids to our kids who are, I've got a 12-year-old, a 10-year-old, and a 5-year-old, to have that conversation, because don't do it is not going to work. It doesn't work anymore.
You're exactly right. And that's the basis of the 7 Challenges program that we use, is looking at, if you tell a child not to do something, their inclination is probably to do it more. But, you know, when they're around their peers, those words, you know, aren't immediately in their mind. And instead, what we focus on is talking to them about making good decisions in general. You know, look at something as, how does it help you? How does it hurt you? You know, what are you giving up for it? And what's some other things you could do that would better serve you? So, yes, having a conversation beyond just say no or don't do it is really important. Just talking about general decision making, because that's really what it is. When it comes down to it, they're faced with a decision that their developing brains aren't ready for, and they get offered something and they haven't thought about it and they just do it. So yes, having the conversations ahead of time is a really good thing.
Yeah, one thing I'll tell you about statistically is 85% of people who use a substance will not become addicted to that substance, okay? It's only about 15% of people who use substances go on to have an actual addiction. It's something that needs either medication and assisted treatment, or group therapy, or being part of a treatment group. But so just because somebody tries something does not mean, oh, freak out, they're addicted and they're going to die, okay? But love them first, and then listen, and then do help them make good choices and guide them toward resources. Call people like Lincoln and Judith and folks and say, hey, we need some help here in my family. But there's a couple of mistakes people make, right? Stigma, remember we talked about that earlier. Well, one of the defense mechanisms that we have is to hide it or deny it. And kids, or anybody, adults or kids, who need help certainly don't need to be denying that they need help. And the family doesn't need to hide and deny and cover up for them to try to keep people from knowing about it. I'm not saying put your business out there, but I am saying don't be afraid to ask for help.
My question is, you're talking drunk driving. I was always referred to as alcohol. What is the breakdown and what is the penalty if you catch a person that is out on drugs? Now, is that a drunk driver?
I think that would be.
Yeah, let's take that.
I knew I'd get the place. I knew I'd get the.
I talk to the children. I don't know that.
Okay. We would have to have our DUI liaison here, and she's not here with the MPD. I don't know the legal factors of getting pulled over. And I think it's different with each case. Not every case is the same. The judge can, rule however he pursues the rule, so each circumstance is different.
I was just curious how that worked because you're thinking of you drunk driving, that's alcohol. Police officer down there, he's
It could be any number of things, but it might be driving under the influence. And there's different ways that they might perceive that, right? And we've seen that in so a couple of high-profile instances with famous people. The owner of the Baltimore Colts, he was like just stopped at a stoplight and asleep at the wheel. And they pulled, so they figured out there's something wrong. Or Tiger Woods, he had that experience as well. So they have different ways of testing. It's not just the breathalyzer.
If fentanyl is such a killer, where do people get it? Why do they want it? And if it's killing so many people, why would they still be taking it? Where does it come from?
Well, it comes from lots of places, but let's just take it apart in different pieces. Why would somebody want it? Let's start with that. And if you have been taking any of the opiates or opioids for a long time at high doses, you have a very high tolerance. And so fentanyl is a whole lot more potent than morphine or some of the other drugs. And it's like 50 to 100 times more potent. And so if your tolerance is super high, you may go to that drug because your body can tolerate it and you're going to get more benefit from it. It hits your system faster. So, that's another part of it. But I might actually really invite some of y'all to come talk about some of this because you've got lived experience. But really, folks who are addicted to opiates and opioids, they're not really trying to get high. That's actually not the point at all. All they're trying to do mostly is not go into withdrawal and stay out of being dope sick. And so they need to get their hit to stay from not going into withdrawal. And it's not so much about seeking, but the higher your tolerance is, a drug like fentanyl is going to be very attractive because it's very powerful. The problem is, one of the things we see on the street is fake prescription drugs. So somebody will go out on the street looking for Xanax or go out on the street looking for a Darvocet or a Percocet. They get something that looks just like that, but really what it is been pressed in some garage somewhere, and it's fentanyl, which is a much more potent drug, and then all of a sudden they're in trouble because that's not what they were looking for. So, do y'all want to say anything about any of that?
I'm going to just be blunt with you. I worked at a pain clinic as a nurse, and I got addicted to opiates that way as a patient and also as a nurse, kind of doing it the wrong way. But I misused my opiates, and fentanyl was one of them that I took. And if you are have ever had surgery or if you're a cancer patient, fentanyl is a wonderful drug. It's a synthetic opiate. It's really strong. If it's used appropriately and you have that kind of a tolerance and your pain's that high, then it's a wonderful drug. But it's made in China mostly and shipped into our country, and it's like minuscule amounts. But heroin is a crop. It's grown. It's from the poppy plant. So it's like labor intensive, weather. All the farmers. You guys know what that means. So fentanyl's kind of replaced heroin. One, because it's potent, and two, because it's easy to ship into this country. It's just such a small amount does such a big thing. So that's part of it. I think that people miss out. And like what he said, that it's so cheap. It's been like if you buy a pill press, which you can buy online overseas legally, and you crush up some fentanyl, mix it with some baking soda or laxatives or whatever, put a little blue dye in it and press it. It looks like a Percocet 30. You sell it for $30 on the street, and it costs you a penny. The other part too is the first time I did heroin. I'm 48. I'm a nurse. I'm a mother of two. I had never seen heroin in my entire life. I had an opiate problem, and it was too expensive. An 80 milligram OxyContin is $80 on the street. A 30 milligram Percocet is $30 on the street. I couldn't afford it with my tolerance. The boyfriend at the time brought home a little bag, and he set it down, and he said, "Jill, we got heroin." And I said, we don't do heroin. What are you, crazy? And he said, "That was $20, Jill. That'll last us like 3 days, the two of us." And it was, honest to God, an economic decision. That's what made me cross the line. It was something I was completely addicted to, and I needed to be healthy. Like what he was talking about being dope sick, that means like having the flu really, really bad. And if I take just a little bit of that opiate, then I'm back to being normal and feeling like Jill again. I'm not high, I'm just not sick. And so it's hard to kind of describe, but that's the best way to describe it. And so when you get into that situation, you really don't even realize how sick you are and what you need. And I think a lot of these people, that's why the reason I tell that story or talk about it so bluntly is because I want you to see, like, I was your nurse. I was going to soccer games. I looked normal. I was talking to my mom 3 times a day. I looked and sounded just like this, but I was really sick. And I couldn't tell anybody, one, because I was horrified and mortified. Heroin? I don't do heroin or fentanyl. That's just, oh gosh, that's really where I am. That's a really big thing to realize. And also, I didn't even realize how sick I was. So, God, I'm grateful to be not like that anymore. But that, to answer your question sort of in a roundabout, long-winded way. There you go.
Any other questions? Any closing comments from any of you guys? Anything else you'd want to share with us before we wrap up?
I just want to thank everyone for attending and listening to us, and I hope that you have learned something today.
I want to echo that for sure, say thank you. And I would encourage you to, if you're really wanting to volunteer, get involved, and help us, help our communities, joining the Prevention Coalition in some capacity and indicating what you want to help them work on is an open invitation.
And I too would like to thank everyone. The community is the solution to this problem. It's going to take everybody.
Thank you again, and same thing. Just educate yourself about what's going on and get involved in your kids' life, and ask questions. The more you talk to them, because I hear kids say all the time, I ask them, have you had conversations with your parents? Our parents don't talk to us. Or, I get kids to say, my parents don't talk to me. So just educate yourself.
One other thing I wanted to mention is a lot of times the kids we see in school are the collateral damage from the older adults that have unknowingly become addicted to painkillers and then moved on to, heroin, those kinds of things. It wreaks havoc on a household. And if there are little kids in that household, they are going to be impacted by that for a very, very long time, possibly their entire life. There's a lot of research recently that shows that adverse childhood experiences when you're young is correlated to all sorts of other physical disease and addictions. So these kids are in a stressful, chaotic situation, which makes them more prone to be the next generation of users.
We appreciate you guys coming out tonight. Thank you so much for your time. Jack, thank you for helping get us coordinated. They'll be around if you have any other questions for a few minutes afterwards. Also, there's a lot of materials out on the table right out in the foyer there about the Memphis Area Prevention Coalition. It is the Memphis Area Prevention Coalition. Many of us live in Bartlett, but we are part of the Memphis area. We're part of Shelby County, and all of these guys, they influence everything we do. They mentioned that part of Kate Bond Elementary, we connect with Cape Bond Elementary. We have a beach club there, so we get into the lives of the children at that elementary school. So it does touch us and impact us. And like it was said, drug addiction, alcohol addiction, it's colorblind. It knows no social boundaries or anything like that. So if you think you might want to volunteer, there's some forms here. They're going to do the Narcan demonstration back here in just a few minutes. If you want to stay around for that, please do so. Jack, do you have anything? Yes, that, and they also have a Facebook page, Memphis Area Prevention Coalition. You can go and like that page and follow that and keep up with everything as well on that. Brother Fred, do you have anything? All right, well, let me close this in a word of prayer, and then we'll wrap up and meet in the back if you want to do the Narcan demonstration. Father.